I'm pleased to say that there are a number of approaches that are in development. In fact, my colleagues and I established a new a seminar series and international network called the Myeloid Network, where we have lectures once a month. And so we have no ending of new discoveries that are being presented. So some of the new molecules that are being targeted include TREM2, which is a cell surface receptor that is on select myeloid cells in tumors. And studies by various labs have shown that inhibiting TREM2 can also promote therapeutic benefit. Those studies are in early clinical trials. Some efforts to inhibit cytokines that recruit granulocytes are underway, targeting CXCL1, 2, and 3, which are produced by many cells in the tumor microenvironment. CSF1R remains a target. There are many efforts to improve that therapy. CD40 agonists, there are also antibodies being developed against what are considered to be checkpoints on myeloid cells, such as VISTA, which is expressed on myeloid cells and can inhibit T cell activation. And there are a number of other factors. There's a large effort to identify novel targets and develop novel approaches. An interesting other approach is to use macrophages to stimulate immune responses. These are called CAR-macrophages. They've been used to transduce myeloid cells that are then injected into patients. And these myeloid cells express CAR T cell type constructs that can then promote a strong immune response and directly kill tumor cells. And these are in early phase clinical trials as well. So I think there's a excitement in the area. The myeloid cells are the most abundant non-tumor cells in a tumor. They can sometimes be as abundant as tumor cells in lung tumors, other tumors. And so this is quite aberrant. This is not what you'd observe in normal tissues. And so it is clear that these are cells we must target. Many of us in the field have shown that these cells are the reason why checkpoint inhibitors often are not effective in patients. Those people performing clinical trials with checkpoint inhibitors have observed that they only help about 30% of all patients. So, and we have found that myeloid cells are often producing factors that simply prevent the checkpoint inhibitors from working.